So the end of disease, what does that mean? That's a kind of an interesting title for a talk. Why would anyone be so presumptuous to say we're going to end disease? Well, we're not going to end disease as it relates to the condition that's in the human population. But I think what we're going to end is the use of the term, which is very off-putting, and I think it has a very high level of discrimination associated. Why? We assume that a person who has diabetes, heart disease, cancer, arthritis, that they're somehow flawed, that they've got genes that are encoding for this disease and they're less than perfect. And so people then take on the role of being a patient, having a disease, so that becomes their identity. Really what we are starting to learn from molecular genetics, it's a very, very different story than what people have thought. What we're learning is that our genes don't tell us that we're going to have a disease. They tell us how we're going to uniquely respond to our environment. So if the environment for that person's uniqueness is disposed in such a way that it signals to that person that they are in a state of alarm, their body will respond from their genetic expression as it should in the face of alarm. They will mobilize defense. That mobilizing defense could be hyperglycemia, which we call diabetes, or it could be inflammation, which we call arthritis, or it could be dyslipidemia that we call heart disease. The outcome that a person has that then presents their condition to the doctor for diagnosis is really not a disease. It's a manifestation of their physiological response to their environment, uniquely defined by their own genes. Now, why is that such an important distinction from just saying they have a disease? It's an important distinction because, number one, it illustrates that they're not flawed. They don't have bad genes. What they have are unique genes that are responsive in a unique way to their environment. So rather than saying, I'm just dialed in to get heart disease because my parents had it, or I'm dialed in to get cancer because my parents had it, what it says is, I'm dialed in to understand what my optimal environment is to express my characteristics in the absence of alarm. So for this person, maybe it's not eating gluten, because gluten for that person produces an alarm reaction, which we call the autoimmune disease arthritis. Or for another person, it may be my genes, because I have the ApoE4 allele, is I got to stay away from eating a lot of saturated fat, because if I do, my outcome would be high blood cholesterol and coronary heart disease. So I need to modify my environment to be rigorously exclusive from that of saturated fat. Or for a person who maybe has the indication in their genes towards increased drive by insulin for producing cellular proliferation that we call cancer, that individual would say, oh, I need to measure and control my insulin levels very carefully. So I need to eat a low glycemic load diet, I need a regular exercise program, and so forth and so on, so that my response to the environment is optimal in what I was given. I'm reading the chapters in my book of life that are related to bliss, to high performance, to excitement, to longevity. That's the chapters I intend on reading out of my book of life. I'm not going to read those chapters out of my book of life that are related to alarm and aggravation and inflammation and attack, which comes from being in the wrong environment. This model, the end of disease as we've known it, is the future of where 21st century medicine is going. And it's a much more optimistic, creative interaction of the person constructing their own journey of life to manifest health outcomes that were previously not realized when we just said, oh, you have the genes for heart disease.